Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Salbutamol. Its brand name is Ventolin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Salbutamol is a beta-adrenergic agonist who selectively binds to beta-2 alphanergic receptors of intracellular adenocyclase. This action increases cyclic AMP levels and results in bronchial smooth muscle relaxation. In terms of indications for use, salbutamol is indicated to be used in the treatment of asthma. It can be used prophylactically to treat exercise-induced asthma. And we can also see it sometimes used to treat hyperkalemia or high potassium. Now, before somebody was to use salbutamol, there is a contraindication that they must clear, which in this case would just be a hypersensitivity to salbutamol or any other component of the product, and there's also some precautions and warnings that they should be made aware of. This medication must be used cautiously in patients who have diabetes mellitus, as large IV doses have been seen to aggravate this condition. And this would be the same for patients with ketoacidosis, as large IV doses of this medication has aggravated the condition. This medication should be used cautiously in patients who have pre-existing hyperthyroidism. Hypokalemia or low potassium has occurred with the use of salbutamol, but is typically transient and does not require treatment. Fatalities have been reported with the use of salbutamol when the recommended dose was exceeded. Rare immediate hypersensitivity reactions have been reported, such as rash, angioedema, urticaria, or bronchospasm. The medication would be discontinued, and most physicians would not retry the medication after this event. This medication should be used cautiously in patients who have convulsive disorders. Asthma deterioration may happen suddenly over the course of a few days or chronically over the course of a few months. We can typically use the amount of salbutamol used as an indicator to see if they're still getting optimal control with their medication. Sometimes we would have to consider alternative therapies and reevaluate the treatment options that are in place. Potentially life-threatening paradoxical bronchospasm has been reported. This more often occurs during the use of a new canister, and the medication should be discontinued immediately. And once somebody is cleared of the contraindication, made aware of the precautions and warnings, and they start to use salbutamol, they can typically expect to receive their dose through an inhaler. However, it is also available as an IV formulation. If somebody is using this medication to treat asthma, they would typically use 2 inhalations every 4 to 6 hours. Also, the FDA recommends that you could also use 1 inhalation every 4 hours. For an acute asthma exacerbation, 4 to 8 inhalations can be used every 20 minutes for up to 4 hours, and every 1 to 4 hours as needed. For the prophylactic treatment of exercise-induced asthma, a patient would typically use 2 inhalations about 15 to 30 minutes before conducting their exercise. So as with all medications, there are some side effects or adverse reactions that patients may experience while using salbutamol, so I'll go over some of those here now. Tachycardia or a rapid heart rate can happen between 3 and 7% of the time. 10% of patients may experience nausea, and 14% may experience pharyngitis. Some patients may experience a backache that comes in at about 2%, and some patients may experience vomiting. About 7% may experience a feeling of nervousness. 5 to 7% may experience a headache, and also 5 to 7% may experience a tremor. Bronchitis or a cough are possibilities with salbutamol. Also, patients may experience nasopharyngitis, sinusitis, or a pain in throat or upper respiratory tract infection. Some more rare but serious side effects would be atrial fibrillation, angina pectoris or chest pain, bronchospasm, or pulmonary edema. That's all we're going to talk about today with salbutamol or Ventolin. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.